Skincare can start in the laundry room. All Free Clear is the #1 brand of laundry detergent recommended by dermatologists for sensitive skin. And it's free of dyes and perfumes. For an effective clean that's gentle on skin, wash your laundry with All Free Clear.
I don't want to scare people away.
No, I love it. I'm here for it. Are we live?
Yeah.
I love it.
Hi.
Welcome, all my internet friends. Me and Kari were having a really interesting conversation. Before we get into it, welcome to the Medicare Cafe pre-chat.
Welcome.
You're joined by your hosts. My name's Olivia Richardson.
And I'm Kari Vogt.
And
we're talking bread and
we're
flour.
Talking bread.
Like, no better way for me to start my day.
I'm like the anti-crunch. Not that I'm anti-crunch, but I don't think about it. So just for clarification,
okay.
Kari started not only making her own bread, sourdough. Did you start
I haven't
the sour
bread from the store in over 2 years?
So did you jump on the sourdough craze of COVID, which was the weirdest outcome of COVID?
I think the sourdough craze started a little before that, but people ramped it up. Like I think it happened before then, but it definitely ramped up in COVID. No, I mean I started after, but I've always been a baker.
Yeah, that's your joy.
Yeah, I've always baked, but then I was like, I should just bake the bread we eat every day.
Okay. See, my mom was like a sourdough person, so we always had like the Frankenstein mason jar of goop in the fridge.
Yeah.
And every once in a while she'd get really sad because it would die.
Oh, she wasn't feeding it then.
No, she had 2 kids. She was pretty busy.
Yes.
You also have 2 kids.
It's my third child.
Yes, truly. She didn't love hers the way that you love yours.
She is my third child.
Okay, so we were talking about that because, I will buy bread from the store. So we were also talking about you mill your own flour.
I do mill my own flour.
And you said the flour that you mill has a 10-day.
Yes. So basically, you're gonna get a little history lesson in a 60-second history lesson here.
This is all I want in my life.
Okay. So at the beginning of the 1900s, people used to totally
Hated that.
Okay. People were you'd go to the local miller and you'd grain your own wheat berries. You grind your own wheat berries. But then they figured out how to mass produce flour by taking the wheat and the bran and the germ out of the wheat. The bran and the germ is what holds all the nutrients in it. But if you take that out, you get this fluffy flour that has a 2-year shelf life.
I mean, when I told her my flour has been on my shelf for probably 10 years.
But it doesn't have any of the nutrients.
Okay.
And so people started saying, okay, well, how can we mass produce this, but also have the nutrients? So they put these synthetic nutrients in it, like the enriched. That's why you have enriched flours, because they put these fake vitamins and minerals in it, but it's not the real bran and germ that has all the nutrients in it. So your
bread is a healthy.
Oh yeah, it's wheat. I get wheat from the Mennonite store. Wheat berries from the Mennonite store.
Okay.
You can get them off Amazon, but it's cheaper to get it through there. And I have a miller that sits on my counter, and I just dump it in, and it's this big. It's a big KitchenAid mixer ish.
Yeah.
It's just got a big modem that has 2 millstones in it, and it just grinds it. And, I could mill corn, I could mill rice, or I can make anything, but.
We are not the same.
Yeah.
I will agree. I know.
Thank you, Lindsay.
Store-bought bread.
Ooh, with almonds.
What in tarnation is happening?
Sorry, Brian.
I'm
We're
sorry.
talking bread this morning.
Were you thinking we're going to talk about Medicare and what's going on in the industry? No, sir. We're talking about bread because I was way more interested in that.
Man.
But welcome, everybody. It is the top of the hour.
If I could have a bread podcast, I would.
If we could, oh my God. Could we call it Rising Sun? Rising?
Can
on the
I
rise?
be a bread influencer?
The bakery?
Oh, yes.
Oh.
We have the cafe. We'll just have the bakery.
I love it. That was more creative.
Man.
Thank you, Sadie, in the corner. Welcome, everybody, to the Medicare Cafe. Again, you're joined by your hosts. My name's Olivia Richardson.
And I'm Kari Vogt.
For those of you who are watching and huge bread enthusiasts, if you have questions, comments, concerns, threats, or promises, text me at any time. That is my phone number. So even if you're watching the recorded version, I love this. Rising with SMS. Thank you, Lindsay.
Oh,
even if you're watching the recorded version, please, you can always text me at any time. Or if you have a YouTube or Gmail account, you can also use the live chat feature, which I think is over in this way or down, somewhere over there. So welcome. Today's topics, actually, we're just having good morning.
The sun is rising and so is
your bread.
I'm loving this chat right now.
I don't know.
Oh, great.
Bread.
Can we start every cafe talking about bread?
Talk about bread.
I'm making sourdough breadsticks this afternoon. I can I can tell you how those go.
wanna-
I can send a follow-up picture to the to the
please,
cafe.
Please send a follow-up picture of the sourdough. I just love sourdough toast. Like that was like my but the thing I hate is sourdough cinnamon rolls. I think those are disgusting.
You weren't having the right ones then.
I'm gonna tell my mom you said that.
You can not ferment them for as long so they're not tangy.
Okay. I don't remember why I don't like them, but I remember I hated them, and my mom.
So like they're
insisted.
not sourdough. Like they don't taste like sour. It doesn't have that tang.
Deal. Today's episode is actually
What are we talking about? Because it's a total surprise to me. I have no idea.
It's super laid back. I just kind of wanted to cover myself, Matt Carson, and Matt McVeigh. We all went to the 7 Figures Medicare Insurance Agent Summit.
Okay.
They're in Salt Lake City. It's hosted by Christian Brendel and his team.
Okay.
And
Was
I just
it
want to
awesome?
give a little recap of the event. I was one of the loafing with the girls. I was one of the speakers there, and my topic was named Why Batman is Better Than Superman and Other Reasons Your Insurance Agency Can't Grow.
Okay.
I got really creative.
I love it.
And, so.
That's really funny you say that because in a lot of when I'm doing my like pathways, I often reference Batman. When I'm like going over my like Medicare 101.
Tell me why. How does Batman... I understand how Batman fits with an agency
It's
growth. How
as
does
of
Batman
late.
fit in with...
And it just rolled off my tongue one day and it has somehow stuck. So like right now, you know, in Columbia, the big university, all the clinics and hospitals like isn't accepting Anthem. And so when I've been going over like Advantage versus Original Medicare, this is kind of getting long, but if somebody asks, well, if I can't have an Anthem Medicare supplement, I can't have an Anthem Medicare supplement plan and go to the university because they don't accept Anthem.
Right.
And I'm like, you can. I said, it doesn't matter if, this is what I said once, and I say it all the time now, it doesn't matter if Anthem is on your card or United Healthcare or Batman is on your card. The plain letter G is what tells like the insurance, or it tells the hospitals and providers like what type of coverage you have.
Hard.
So I talk about Batman a lot.
Okay. Well, I did too, and I got a lot of mixed reviews on it. Not the speech because it was fantastic, but more so on like there was a lot of people afterwards that was just like, listen, I understand, but I still love Superman. Like you can love Superman, but Superman is never gonna grow an insurance agency. So just to give you a quick update, it was a really incredible event. Really enjoyed it. Really high quality, growth minded agents who are there, agents who were literally looking for what things I love about events like this is that you get both. What am I doing to grow my agency tomorrow? What can I implement today to grow my agency tomorrow? But it also talked about a lot of long-term shifts, a lot of long-term changes. Craig Ritter, our partner from Ritter Insurance Marketing, he was on there. Someone called me. The audacity. So was on there kind of talking about the future of Medicare, what we expect to see in 2026 AEP. So there's a lot of, we just did a webinar on that, a lot of good content. If you have questions about what his presentation was, let me know. More disruption, more chaos, more movement, a little bit more stability in some areas. But again, a lot of carriers have already been really upfront that they're pulling back again this year. So probably less service area reductions, but still a massive. Last year, everybody got the attention during AEP. So you're going to have even more questions, more need for education, so on and so forth.
I've had a lot of my financial advisors that I work with have been like, are you worried about this AEP because of all these? Because I've told them like, hey, a lot of your clients are getting very large rate increases on their supplement plans. And they've been like, do you think people are going to switch this fall? And I'm like, that's a great question.
Yeah.
So people are thinking about it, I feel like.
It was interesting, and we don't have to get into this too much, but what's interesting about like the switching rate, again, we're a partner with Deaf Research. Deaf Research is so helpful when it comes to this, but where they're finding areas of people switching from a Medicare Advantage, I will say that this was the largest switch, this past AEP was the largest switch from people on a Medicare Advantage plan
Back to original
Medicare. This was the largest amount of switching rate.
Was it because of all the plan?
A lot of it was because of, and the heightened areas was in SARs. So the same areas where you saw the largest switches from Medicare Advantage to Medicare supplements were also the areas that had the biggest influx of guarantee issue Medicare supplements. And so, again, that's why you're seeing these areas get hit really hard with MedSup rate increases, because people wouldn't have been able to switch to them otherwise. They were too unhealthy.
Right. Yeah.
And then, and then people who were healthy, we still saw a significant amount of people go from a Medicare supplement to a Medicare Advantage plan. So I think it's kind of, this is me just guessing and reading the tea leaves, seeing that if you were unhealthy, you went back to a MedSup. You took the opportunity.
Yeah.
If you were healthy, you went to the Medicare Advantage, just kind of further dividing that line. We'll continue to see a huge thing going on in 2026 AEP. PPO plans, $0 PPO plans are going to be few and far in between. If they are, they're not going to. Yeah, $0 PPO plans
are going away.
Going away is a strong word. They're not profitable. They're not a profitable.
So they're going to
model.
start having premiums.
They're either going to start having premiums, or a lot of plans, a lot of companies have come out saying don't expect to see these this year.
So more SARs.
More SARs, probably, or crosswalking, if they can get it approved. Crosswalking
to another plan.
But there's not going to be much likelihood available, because, again, those PPOs are becoming a thing of the past. We're just going to have to get back to using, whenever Sadie's our producer, she's in the room, her and I used to do this training called MedSups versus Medicare Advantage plans. And each year we would do it, the differences would get fewer and fewer, mainly because Medicare Advantage started offering nationwide networks. They started offering, these crazy, it was literally, the reason you go to MedSup at that point was you don't have a network, but most of these Medicare Advantage plans really don't have much of a network anymore. They are pretty widely available. We're seeing, I think this year we're going to see a dramatic stop to where HMO plans are going to be the benefit-rich plans, and you're going to see not a ton of PPO offerings. So it's going to make
that's kind of a curveball, I feel like.
It's going to make the choice much more clear between a MedSup and a Medicare Advantage. It's going to truly be if you're afraid of networks, you need to go to MedSup.
I feel like in this area, after what has been happening with Anthem, it's going to be people aren't going to like that.
Yeah. Well, and then you're also seeing you're also seeing on the Medicare Advantage side 2 types of networks. You're seeing carriers like your UHCs, like your Humana's, that's trying to offer wide networks but stay with those PPOs. They're big enough that they can negotiate those contracts. You're starting to see more of, I'm going to say regional, but I don't even mean regional.
Yeah.
I mean boutique style Medicare Advantage plans.
Okay.
To where they're going to be high service, high benefits, high utilization. They want people to utilize their health benefits, but the networks are going to be very, very select. I'll take Devoted, for example. Devoted started regional, trying to go everywhere. They've announced it. If you haven't seen them, call us. They've announced their expansions for 2026. Still a company that's looking to grow. Cigna, I put in that same category of carriers that are still looking to grow, where other carriers are maybe pulling back. But they're that boutique style of network where they're only going to pick 1 or 2 network partners, but they're going to be really selective.
But they're going to have high benefits.
High benefits, smaller or less, what's it called? When you have to get pre-authorizations, you're going to have less dealings with pre-authorizations. You're going to have better communications, more holistic care, better communication, and better customer service. But the networks are slim. Yeah. So it was interesting.
Gosh, that's hard.
You're going to have.
I don't envy my clients.
I know. Well, and that's just it. It's our job as advisors to say, you have to find out. We did this last year, but it's even more important this year. What do you care about?
Yeah.
And it can't just be.
What's more important to you?
All my clients are enrolling in this plan because it kind of has everything at one out this year. It's not going to be that at all. It's what is most important to you. Thankfully, we will have a solution for all of them, but we'll have to have more companies and more product on our shelf than we ever had before, and we'll have to do a better job fact-finding.
Man, I wasn't prepared for that AEP twist.
I mean, it's the same AEP we had last year. That was kind of the same rules.
Well, I guess I wasn't participating. I need to go back to bed and learn how to speak today.
Go eat some bread.
Go eat some bread. I was too excited from all that bread talk. I don't know how to talk about Medicare.
I really don't want to talk about Medicare now. I want to talk about bread some more.
I just wasn't anticipating them having a premium.
I mean, they had to file. Carriers had to file what their plans wanted to look like to CMS in the first Wednesday of June. So I think that was June 3rd. So almost a month ago, they had to file that in. So a lot of the carriers that filed it, they've also said, though, that they're going to keep things really close to the chest, just like they did last year. Because, they don't want to publish it to where they don't want to publish their information while people can still make changes or still, do, in that refiling time. So it's going to be another year. Like, it's going to be late August before we know anything. Share shelf is going to be really important. I mean, like, honestly, it's going to be certify early. Yep. Share shelf. Share shelf means you have companies and products. You have more than just a few carriers. Oh, yeah. Right? Share shelf is how deep is your bench as far as go-to companies and carriers and plans. I haven't certified yet. I paid. I like lose my login every year. So I'm like, all right, step one is find your AHIP login and pay. I've done that. You do AHIP. I was wondering, I'm curious out there if any agents do the NABIP one. Because the NABIP one did launch. It is cheaper. AHIP is $175. NABIP is, I think, just $100. Most carriers will give you the discount with the AHIP, the $50 discount. I don't think they're giving them anymore. Yeah, a lot of them carriers. I paid a lot of them stopped. A lot of them didn't do it last year, but it's $175. So with the discount, it's $125. Right, but I thought I paid $175. Yeah, a lot of carriers are doing it, but they didn't last year because they didn't know that they could until it was too late. Because that was part of the whole, like, you can't give extra dollars on top of the incentive. So that was part of it. But I think most of them are. So great question. Mary asks, is NABIP including Aetna this year? No. That was my question. NABIP, it looks like NABIP is most carriers, the large ones, are accepting NABIP. Aetna is the only one that's holding out. Aetna does not require the AHIP. And they don't. Aetna does not require AHIP. They have their own testing that they do. But they all have their own testing. Right. On top of AHIP. A lot of them will just have like some questions and some little quick videos. Aetna's is really easy. I mean, like, especially I do with a couple of question answer errors on AHIP. Oh no, are there errors on AHIP already that people know about? There's always the first anytime AHIP comes out, I always say wait at least 2 weeks. Then explain more. Then just finished AHIP with the discount. Discount. I can't believe I looked. I didn't think there was discounts. So think they'll give it to me if I go back? No. I think one thing to mention about the NABIP training is kind of just like where your money's going. I'm not going to advocate you take the AHIP over the NABIP. Yeah. Because like if you take the NABIP but you still have to do the entirety of the Aetna training, that's kind of silly. Went through Aetna for the AHIP discount. There you go. Aetna doesn't require AHIP? Aetna does not require AHIP. But they give a discount. Neither does UHC. UHC doesn't require AHIP. Yeah, I did know UHC did. So whether I do. So no, Mary, if you do AHIP with Aetna, then you get a skip out of the majority of the training. If you do NABIP, I hate these acronyms. If you do NABIP and you're doing Aetna, then you have to do the entirety of the Aetna because NABIP does not transfer over to knock out those Aetna trainings. What are agents doing about the non-commissions on PDPs? Gosh, what a great question. Just doing them. I have just been doing them. Yeah. I've just been doing them. I mean, I don't know what else to say other than like you can't not do them. I hear you. I'm in that same camp. It's just a bucket up and we're doing it. PDPs are fingers crossed that it's not always this way. Fingers crossed it's not always this way. Mary says drinking. PDPs, I am under the impression that you do need to continue to offer support with PDPs. Yeah. And that's because PDPs are the single most confusing and sometimes the most financial driven conversation in regards to somebody's healthcare. It's the most commonly used portion of their insurance. It is prescription drugs. I mean, majority, I think, it was the percentages of people over the age of 65 that are on 2 or more medications is incredibly high. It's what they're using. So a lot of people are basically saying it's just kind of a necessary, it's just a cost of doing business. Yep. But I would say if you are somebody who is going to be doing prescription drug plans this year, you can't afford to do hour-long appointments
Yep.
and not get a commission on it,
Yep.
quite frankly.
No,
So
you
there's
can't.
got to be ways to figure out how to lower the appointment time, get the information up front, and lower the support
Yep.
on prescription drug plans. I can't think of a better way than doing that than utilization of technology and utilization of just group education. Like just
Yeah.
doing full educations on the IRA, seminars, just group ANOC conversations, and then utilizing technology to self-enroll.
Have we seen anything about like the Eliquis, Xarelto, like the 10 drugs for next year?
Yes. But what question about them?
Do we know what 10 they are
We do know what the 10 are.
and what the prices are going to be?
I don't know what the price is, but keep in mind that's the way that affects the carriers, not the clients. So keep in mind, a lot of the carriers we're talking about, like these negotiated drug costs and these negotiated drug prices. It's actually whenever we thought like, okay, here's a break for the carriers because there's these incredibly expensive medications the carriers are now going to have negotiated prices with. They're going to pay less for those medications. Wrong. Turns out that these carriers were already receiving rebates for these medications, and the rebates actually made the drugs cheaper than the negotiated prices. And when they had the negotiated prices come out, the pharmaceutical companies got rid of the rebates. So it's either a
What
net
in the
neutral
world?
to where the carriers actually aren't saving any money, or is actually costing the carriers more.
So moral of the story is clients aren't going to save money next year on those drugs.
No. I mean, they're going to be built. I mean, they're built into the formularies of how they're covered. I would have to do a little research of like if the negotiations of like
I
how
feel
those
like
formularies are covered.
I get asked about that all the time.
Yeah.
Like people are like companies and whoever is advertising that if you take Eliquis, it won't be as expensive in 2026.
Yeah. Let's see.
What have we even talked about what we're talking about today?
No, and we really don't even have to.
I was gonna say this
The
is like a
only-
record on chat.
Yeah, the only thing I was going to address was going to be the way that I compare Superman's, Alfred, Robin, and Gotham Police to your growth model.
Okay.
But like, let's answer some questions in the chat first, because I want to make
Okay.
sure we're addressing those.
I don't know where we left off.
I
Can you
don't
send them
either.
to Medicare? Can we send what to Medicare?
Okay, so for your part, I think there's a lot more questions on Part D. Sadie, would you do me the biggest favor and kind of read through those questions and let us know if there's any that we haven't addressed yet? Because a lot are coming in and I can't read them this far away. I'm also blind, apparently. So a lot of people say, can we send them to Medicare.gov? So here's where it comes down.
Oh, can we send the client?
I'm assuming. So a couple of things when it comes to Medicare.gov. Number one, it's not happening this year, but it was in there has been talk in the federal government of actually eliminating the shopping and comparison tool with Medicare.gov. It's not going away this year.
It's
But just
not.
understanding that I can't imagine that it is. Like, I mean, I guess it could be. I haven't heard that it's not. But it was just on the discussion to
Yeah.
get rid of it because the utilization of it was very, very bad. It also was incredibly inaccurate.
Yep.
So whenever people were comparing the drugs on things like Medicare Center, Connecture, Sunfire, compared to Medicare.gov, Medicare.gov was wrong
all the time.
all the time. And they found out that Medicare.gov actually only updates their information once every 2 weeks. So even when they found out information was incorrect, it was going to be incorrect until the next upload,
Yeah.
potentially up to 2 weeks. So I don't recommend utilizing Medicare.gov to shop and compare drug plans or Medicare Advantage plans. So you can. There is also a CMS regulation that says it's not even it is CMS, but it's more so the carriers that if you are not contracted, ready to sell ability with an individual, then you do not have permission to talk to them about prescription drug plans. So what I mean by that is if you don't hold a contract with Cigna PDP, Aetna PDP, UHC PDP, whatever the case may be, you actually can't advise on those products at all. The carriers
Right.
did not give you didn't sign a contract with them. You didn't
Right.
give them. So it was actually at the time illegal, not illegal, that's dramatic, but against CMS compliance to actually go and help somebody shop on Medicare.gov if you didn't have those contracts. You couldn't do it because you were representing carriers that you can't represent.
Yeah.
Now, there is an idea of if you help somebody, we do have some agents that do this. They'll run the comparisons, they'll shop the plans with them, they'll do all that, but then they'll send them and say, you can either call 1-800-MEDICARE or call the carrier and enroll yourself. I don't want to be agent of record on this. The reason why some of them did that is because they didn't want the compliance nightmare or the supporting of it and just saying, like, I don't want you to file a complaint against me if this plan doesn't go the way that you want it
Right.
to. If I'm not contract with that carrier, then you can't
That's what Judy was asking about. Is I was told that if a PDP is non-commissionable, we aren't authorized to sell them, so it could come back on our E&O.
No.
So
That's
I've
been the biggest rumor.
I've still been doing the enrollment. Probably 75% of the time, I still do the enrollment for them, and I just it's so funny because it says non-commissionable on Medicare Center. And people ask about it all the time, and I'm just like, yeah, I don't get paid. I don't get paid on this. But like, they're just like, really? Like, it's just another like feather in our cap, I feel like, when they see that. I sometimes like, because a lot of my enrollments I do like over the phone. If I'm doing something over the phone usually, or like sometimes I have sent them, like it's usually WellCare. Like if they're signing up for WellCare, I have strict instructions. Click on this link, type in your zip code. Do not sign up for this plan. Like you want this exact verbiage, and then they self-enroll. I did that a lot during AEP last year for just, it was easier, saved me time. But beginning of this year, I've done probably the majority of the enrollments. And yeah, it can't come back on my E&O, correct?
No, I mean, I always read the fine print on your E&O, but there's nothing in an E&O that would state that, like, if it's a non-commissional product, that you're not covered for that.
Yeah.
That rumor started like 2 years ago, or I guess the first I heard it was actually our key accounts retreat, maybe 2024 of like May of 2024. So I guess about a year ago. But again, I have yet to see an E&O policy that outlined that non-commissional products you don't get paid on. Where a lot of people get confused on that is like if the product is not in the realm of, it's not a product that is commissionable, right? So it's like if you're giving advice or doing something on a product, not like a plan that used to be commissioned, now it's not commissioned, but like on a service that is not a commissionable service and the frame of what merits something that is commissionable, then that is where a lot of the E&O gets. So there is non-commissioned verbiage in E&Os, but it's not talking about the sales of plans. It's talking about different types of advice, of if that advice is a commissionable service or not.
Judy said she thought that came from Chaylin. Mary says, well, companies let us still advocate if we submit. So I think one of the ways, like I've described it, and I hope I'm right here, is that like, you know, if somebody's on a WellCare plan, I did the enrollment. I usually tell them, because this is non-commissionable, we aren't listed as the agent, right?
Usually if a
like
plan,
if you do the agent, like I could not call on their behalf.
You could. It depends on the carrier. Because carriers, when a carrier goes non-commissioned, they will decide because non-commissionable is not the same thing as agent of record or serviceable or servicing status.
Okay.
So most of the plans, if they are non-commissionable, but you are the person who enrolled them in that plan, you still do have servicing status and you are still listed as the agent of record. Not all of them.
Not all of them.
But a lot of them, that is the case.
Because I think like after I do the enrollment, I usually just say something along the lines of, because this is non-commissionable, I can't call for you, but if you have any questions about this, still call me first. I'll walk you through it. If we need to call the customer service line together, like I can help you, or if there's a problem. But like, I thought on all of them, I couldn't call the provider line.
No, I know like Silver Script, you can call. WellCare, you can call.
You can call on WellCare.
Yeah, you're just not getting paid for it.
Right.
Okay. Which is crazy because WellCare had like their best year ever in PDP sales and didn't pay a dime to agents last year. Let's say EP. They were still like the number one PDP in
who? WellCare.
Yeah, and didn't pay a dime out to agents. So I mean, like it's still happening. And again, it's all about like. I think the question is, how much do you want to be able to service the business? It's a retention move. It's a referral move. I'm on the camp of this. My 2 cents, quite frankly, is be the agent of record and service it. But when it comes to enrollment, the appointment needs to be 15 minutes or less, preferably 0 minutes, utilizing technology. You send them the link. You send out, you collect, you use Client Sync or Retire Flow or whatever service you're using. Get the information ahead of time so you're not spending appointment time collecting drug information, verifying information. If they're not willing to do that, that may not be a person that gets your help this year.
I think one of the
always exceptions, but like that may not be a client for you.
One of the best changes I've made this year is with all my new clients. You know, I talk about, you know, you'll hear from me every fall during open enrollment. I have made it a point to say, you know, you're going to hear from me, but we might not need a meeting every year. Like I'm going to find out, like I will need your updated drug list, and you're going to hear from me of whether, hey, you should just stay put, or there is a plan change that needs to be made. And most of the time that can happen over text or email.
Yes.
Like I have said that with every client this year and they're like, oh, okay, great. So I don't have to come back in.
Yes.
I'm like, not if you don't want to.
Clients don't want to go to their insurance appointment. Like that's not like a thing that's like the most fun thing they do is talking about their insurance. No matter how wonderful you are, that's still something in their day that most don't want to do. I'm seeing some question about like, well, I remember when Cigna was non-commissionable. Keep in mind, Cigna wasn't non-commissionable for their PDP. They just said no agent sells for their PDP. They did not allow.
Wasn't last year the first?
Last year was the first year that they allowed agents to write their drugs, to write their prescription drug plan. So that one was like Cigna was one that was like you are not agent of record, you are not the servicing status, you cannot do anything, you are out. I'm seeing a ton of questions. Sadie, was there something question that we haven't really hit on? Okay.
Marcy said PDPs are my main gig, so I'm really hurting this year. I am now down to 2 plans for 25, 26. I'm in a very rural state, and my clients call me every year. I am thinking of drinking a lot.
Marcy, I'll come drink with you. That's fine. Never drink alone. Always have an accountability buddy.
Marcy, what I would do, I don't think it's a bad thing to tell your clients that you're not making money off of those. I mean, Olivia might disagree with me, but
I don't disagree at all.
I think that just shows how committed you are to what you do and how good of an agent you are, and ask for those referrals from those clients that you are not getting PDPs from. They all have friends. If that is your main gig, that's really what I would focus on, is just telling them like, hey, things have changed over these years. I'm going to continue to do your drug plans, but I don't get paid on these. So like, if you have any friends or family that you can send my way, I'd really love to help them.
Mm-hmm. Not that I'm recommending this, because I'm actually not even going to finish that statement, because I don't believe in talking negatively about competition. I think it's a bad move. I think it hurts you more than harms you.
Oh, yeah.
I don't like that, but I do know if you are somebody that's going to be servicing prescription drug plans, a lot of agents are not. Mm-hmm. So there is a lot of ways for you to show your value.
You're the complete package.
Show that you're the complete package. There's a lot to go with that. I don't think that you should go out and be blasting people or anything like that. I was going to say, like, do a video saying, like, if your agent's no longer doing this, I still am because of da-da-da-da. I don't even know that I like that, but I would, if you are going to be doing drug plans, I would let the world know. Referrals and cross-selling.
I agree
100%.
with Mary. Marcy, are you selling them the supplements too, or just the PDPs? I guess, why is that your main... Why would that be your main
I took
sale?
it as Medicare supplements are your bread and butter, and the PDPs come with it. But if you're not writing the supplement with a PDP, then you're probably actually losing money by only servicing the drug side of it. The drug plans are like an entry. It's like a paid lead source. And in this case, like, it's prescription drug plans are leads.
Yeah.
Right? Like, I mean, truly, if you're willing to write the PDP, some leads you actually make money on. In this case, like Cigna right now is about the only company that's still paying commissions on Part D. Some of them you get the dollars on, but the rest of it is like, instead of paying money for the lead, you're spending time.
Especially if you're in Missouri, Marcy. I don't know where you are, but I mean, a PDP, get that MoGI, like do the anniversary switch. If you get a new PDP client, like.
Or underwrite, like
obviously underwrite if they can. So many bonuses.
Yes.
I've been encouraging my clients to call their representatives to let them know what a difference an agent makes when it comes to helping them with their drug plans.
What's really exciting right now is that there is a ton of looking at an agent and how does an agent help with the buying process. And I'm noticing a significant shift. Part of that is with the Trump administration and the like of Medicare Advantage plans and things like that. But I am seeing a significant shift of, we need to invest in insurance agents for a couple reasons, but primarily it's cheaper to have an insurance agent do it than to have SHIP or to have
it would
people
have to be
shopping and self-enrolling. So like the fact that we are cheaper than alternative methods is a huge, especially with this administration, huge feather in our hat for that, of making sure like why insurance agents are so important. Now, we know why it is. It's because who can do this on their own? Like, who could do this?
I mean, they need to just ask their clients
100%.
or ask that demographic, because all of our clients say how invaluable we are.
Yeah. Marcy, if you're only writing the prescription drug plan, let me tell you, I think you need to call our team. PDPs open up the supplement business, but these are my current clients and they write every year. So Marcy, definitely, I would highly recommend calling our team, or if you're working with an upline, working with your upline to do so.
South Dakota, is that what?
South Dakota.
Okay.
Yes, South Dakota. We actually have a team member located in South Dakota. So I would just say, because PDP business, if you're only writing PDP and doing that year after year, not seeing a ton of MedSup growth, not seeing a ton of Medicare Advantage growth, one or two things need to happen. One, what's your next step? Are you looking to be succession, or are you looking to kind of take a break from the insurance industry and that's why you're not growth heavy? Or two, we need to make sure you're getting the most out of your current clients. Are you talking to them about annuities? Are you talking to them about cancer insurance? Are you talking to them about hospital indemnity? Well, you don't really need a hospital indemnity on MedSups, but are you talking to them about long-term care, final expense? Give us a call. Happy to make sure that you're actually working your current book of business and growing it versus spinning your reels on PDPs. It's 10:35. I love it. Would love to talk more. I think we're going to get access to my recording of the Batman versus Superman one. So we'd love to make part of that available once it becomes available. Not the entirety of it. Obviously, I want to be respectful to Christian because he's still making those available for purchase. But yeah. I can't believe insurance companies are doing this to the agents. Yeah. Yes. Perfect.
Just gotta roll with the punches.
Well, and that's just it, guys. Like right now, it is survival of the people willing to survive. Yeah. Like I don't know how else to say that. It's who can survive the longest? Who can? I will say, and when we're talking to Medicare supplement companies, we just saw more carriers kind of pulling out of certain states. The Medicare supplement companies that are doing really well right now are the ones that saying we're hunkering down, we're waiting for this to pass. It will pass, but we just have to out-survive the turbulence. Yeah. And I think us as insurance agents have that mindset, but there's also so much opportunity. Yep. So much opportunity. You could have another best AEP of your life if you play your cards right.
We're going to do it.
Let's go. Awesome. All right. Thank you guys. Again, thank you, Kari, for joining me. Yeah, thank you guys. I love the interaction today.
Yes,
today was a very fun,
very
fun episode. We'll continue to have more conversations about tips to improve your AEP, and I think
maybe even flour next time. Maybe even some more flour.
Can you bring me? I want to do a side-by-side comparison of like enriched flour versus your flour.
Oh, sure.
I want that in my life.
Okay.
I just want to do this. Awesome. Yeah, William's like, I felt a lot better when the discussion was limited to bread. Me too, William. But we're gonna go out there and make that bread.
We'll start the Medicare We'll start the Medicare bakery after this.
Perfect. Until next time, guys, have fun,
make money,
and give impeccable service. Thanks, y'all.
Thanks.